If you're a physician in 2025, chances are you probably already have the Doximity app on your phone. But here's the thing. Did you know you're only scratching the surface of what this app can actually do? Today, we're going to dive into this app and I'm going to show you some different ways that it can save you time, help you connect with your colleagues, as well as potentially even make you money. So let's go. The Doximity app started off as kind of like a Facebook or a LinkedIn, but exclusively for doctors. We have this weird profession where we go through these phases in our career, right? We initially start off in undergrad, we then go to medical school, we then go to residency, then fellowship, and then finally into practice. But along the way, you develop friends and colleagues that you see for 4 or 5 years at a time, and then you just kind of drift apart from. The reason Doximity gained so much traction early is because it allowed physicians to connect with all those previous sets of friends that they've had throughout their training that they may have lost touch with. It was a really great way to kind of be exclusive for doctors because they put you into your medical school graduating class or your residency graduating class, and they use those years to connect you with other people around the country that also use the app. Doximity was started by a non-doctor but a medical entrepreneur who initially developed the Hippocrates app. Now, if you remember, that was an app that lived on your phone that was kind of like the digital version of the pharmacopoeia. You could look up drug interactions and specific antibiotics and that type of thing. And it was a really helpful app. And this particular founder, whose name was Jeff Tangney, then sold that app and then started Doximity. I have a soft spot for entrepreneurs who are trying to help physicians, so this is an app that I wanted to go through and discuss because they've really done a lot of work to make this a very useful app for doctors. Even though Doximity started off as kind of a LinkedIn for doctors, it slowly evolved to a social media app that is really medically focused. The initial portion of the Doximity app was essentially like a news feed like you would see in Facebook. A bunch of different articles that can come across your feed that you can interact with, like, or read further if you click on them. This particular news feed was really helpful because it curated everything to your specialty and focused everything on medicine. The other thing about the news feed that was interesting is you saw a lot of the comments from people that are really well versed in these topics, either disagreeing with or agreeing with the actual articles that have been printed. The nice thing about Doximity is what it does is it forces you to kind of put your credentials out there. You're not hiding behind an anonymous avatar or anything like that. It's you and your colleagues that are discussing specific medical topics, and it really gives it a sense of professionalism, and it makes the dialogue, especially in the news feed, more civil because there's no kind of bickering back and forth because you truly are discussing with other experts in the field. The second feature that I want to talk about with Doximity is what's called DoxGPT. Now, a lot of us have used ChatGPT, and what DoxGPT is trying to do is be the medical workplace for you to ask questions about specific medical topics that are doctor and provider focused. And the actual large language model is curated for medical journals and clinical guidelines. And so what that does is it allows you to ask a medical question and then feel confident in the actual information that you're receiving. A lot of us have used ChatGPT, and patients as well, right? Have used ChatGPT to ask it medical questions. And the information you're getting back is not curated because it's taking all the information from the internet and basically trying to synthesize an answer for you. The difference between that and DoxGPT is the Doximity team has curated the information that they're putting into this GPT-type large language model that allows it to be more medically specific from reputable journals and clinical guidelines that gives you a little bit more confidence that the answer that's being spit out is going to be consistent with something that you can use in the clinical setting. Doximity says that the DoxGPT is trained on 750 hand-curated journals. So they're picking the journals that they're going to include in this data set, and that's what you're querying when you're asking DoxGPT specific clinical questions. In addition, they try to draw clinical guidelines from the various medical societies so that they have the latest information and the most relevant guidelines for physicians who are asking it questions. One of the interesting things, I think, is whenever we're talking about these curated medical GPT or large language model type services, we have to ask ourselves, okay, first of all, who are they that are curating this information? And number two, how are they making decisions about what information they're going to include and what information they're not going to include? For instance, of course, you're going to include the New England Journal of Medicine in your data set. But are you going to also include the Romanian Journal of Rheumatology? Well, maybe not. And somebody has to make that distinction of what journals get put into this large language model and what journals are going to be being drawn from to give physicians information. If all physicians decide that they're going to start using these type of models to help them in their clinical practices, you need to ensure that we know exactly what information is being put in, as well as what information is being kept out. I know a lot of you are using open evidence. That's another situation where there's a company that's behind the information that's being curated to present to doctors. So because it's a bit of a black box, that does give me a little bit of concern that maybe we need to have something that's a little bit more open, that people can know exactly what's being put in, why it's being put in, and what's being kept out, and why it's being kept out. The third feature that I wanted to talk about today is what's called Doximity Dialer. It's something that's a really simple concept, but it has caused physicians headaches for a long time. We've all received pages or texts for us to return phone calls to patients, whether that be on call or whether that be in your office. Well, you want to be able to return those phone calls from your cell phone, but you don't want to give up your personal phone number to all of your patients. So what Doximity Dialer does is it spoofs your phone number to act like your caller ID is coming from your office. It's a very helpful thing. You can be at home, you can be calling in the middle of the night, you can be playing with your kids and calling patients, and what it'll do is it'll show up on the patient's caller ID as your office number instead of your personal number. I use Doximity Dialer a lot of times for my car. As I'm driving home, I'll call the patient's family member. Again, it comes up as the number from my office, which is great. There's another component of the Doximity Dialer that's also a text message service. And again, the text message acts as though it's coming from your office. And it gives the patient an idea that, hey, you have about 24 hours to read this text message, and then after that, the ability to reply to it is gone. And so it's a really neat feature because what it does is if you want to text a patient and say, hey, I got your results, everything's looking really good with your blood test, it gives the patient a chance to respond or ask a question, but only for 24 hours, and then it's gone. And again, it doesn't give up your personal phone number, so you're not necessarily losing that privacy that you'd like. Now, the dialer feature and the text feature do have some drawbacks. The concern, of course, is that these discussions that you're having with either a patient's family member over the phone or the patient over the phone, or text messages that you're sending back and forth with the patient aren't being imported into your electronic medical record. And that's somewhat of a concern, right? You'd like to have a documented record of your conversation, not just for billing purposes, but even for just continuity of care. So that's the one downside to the Doximity Dialer and the text messaging service, is that it doesn't really carry over into your electronic medical record. I would really like to have that feature going forward. I do have some connections on Doximity that are colleagues that work in the same area as I do. And Doximity has a feature where you can message them HIPAA compliant about specific patient issues that you're having with the patient that you share in common. It's helpful, but I'll be honest, I don't use it. The reason for that, of course, is it's not connected to your electronic medical record, and you can't necessarily attach a patient so that the person that you're sending a text to or direct messaging knows exactly which patient you're talking about. So I tend to fall back to the hospital-based systems where you can actually attach a patient and you know that that information is stored in the electronic medical record, as opposed to using Doximity for that particular portion of direct messaging colleagues for referrals or updates. Doximity has just rolled out a beta version of an ambient scribe. If you don't know much about ambient scribes, please check out my other video that talks about what ambient scribes are and what they do. Basically, they are a device that sits in your office while you're talking to your patient, records the conversation, and generates a medical note. Doximity has their own version that does this, and although it is a good product and it does exactly what it purports to do, again, the lack of integration with your specific electronic medical record makes it not as useful as a standalone product that does work with your electronic medical record. So although the feature is kind of neat to use, and it's a good way to kind of dip your toes in to see what ambient AI scribes can do, because you can use that Doximity app when you're just talking with one of your patients and then come out of the room and just check the app to see, okay, how did it generate this note and how good it is. So I think it's kind of a good way to dip your toes in the water to see what ambient AI scribes can do. But I don't use it in my practice because again, it doesn't attach to patients, number one, and number two, it doesn't integrate with my electronic medical record. Another useful feature of Doximity is the job board. They do have curated job opportunities that are specialty specific and location specific. If you indicate to Doximity that you're looking for a job, the full court press starts at that time. They do have a lot of connections with recruiters, and the job board can be somewhat helpful, especially if you're looking for a job in a specific area or be a specific specialty. We've all accidentally given our information to a recruiter here or there, especially when we're in training, and then all of a sudden you get text messages constantly about new job openings. None of us really want that. The nice thing about Doximity is it keeps your personal information private and connects you to these recruiters via the app. So whether you want to click on that jobs posting board or not is totally up to you. And if you're not currently looking for a job, you can just leave that whole tab unused. I'm sure Doximity has a lot of future features in the pipeline. They are always iterating and trying to make doctors' lives easier, which is great. I have a soft spot for entrepreneurs that actually are out there trying to find doctors' pain points and trying to alleviate them. And I think this founder is doing just that. When Doximity was initially going public and starting to offer their stock to the public, they actually came to doctors first, people that had been using the app before it was going public, and said, hey, we know that you're doctors. We really appreciate that you tested this app for us. We're going to allow you to participate in the initial public offering of our stock before it goes into public markets. I thought that was a really nice touch. Basically what they're saying is, we understand that you were an early beta tester of this app and now we're going public and we want you to be part of that. That's a really awesome sentiment from the founder and from the Doximity team. Oh, by the way, the stock is crushing it. It's a really well-run company. And so I think those that participated in that initial public offering got a great deal. Of course, we all get bombarded on our social media feeds with a lot of weird articles about stuff we're not interested in. I do think that this is interesting in that it curates the information to medical specific information, and that way if you're in that mood or that mindset, you can definitely scroll through and feel like you're gaining something as opposed to just having a bunch of clickbait articles. And just to sum up, I think this is a really useful app. It's geared towards doctors, and what they truly tried to do is look at the pain points that physicians are having and what are some ways that with technology we can address these pain points. That's the whole goal of this channel as well too, is to use technology to find ways to help doctors be more productive, spend less time at the office and more time at home, as well as to practice smarter, not harder. Thanks a lot for watching this video about the Doximity app. I hope you got some information for it. Feel free to like and subscribe if you enjoy the intersection between tech and medicine and how that can make us more productive and provide better care for our patients. Thanks a lot for watching, and we'll see you next time.